This lecture, which is called Conducting Experiments, we will focus on more detailed attributes of experiments that you need to think about. So these details would include selection of participants, how you are going to manipulate the independent variables. This means setting up multiple conditions. Then measurement of dependent variables and how you will select it. And also additional controls. And then some details that you need to pay attention to in when you actually carry out the procedure. Okay, even though probability sampling to produce representative sample is desired in many cases, in experiment your focus is not so much of external validity. You're more concerned about the internal validity. Therefore, experiment is often conducted with convenience sample, which is actually not the probability sample. And the sample size should be as large as possible. But you can actually look at the past similar studies to make kind of some guess about what is the size of the sample that's required. Once you have a research question in experimentation, which is manipulation of independent, include manipulation of independent variable, such as, for example, authority in this case, it needs to be operationalized by creating two or more conditions that differ in a specific aspect. So let's say number one here is an example. Authority is operationalized as an act of obtaining the security clearance. Like in one condition, you need to have a maximum security clearance, like for example, fingerprint, pictures, and so on. So the other case, it's not. That creates a difference in authority. Number two, wearing a lab coat versus wearing a plain clothes. Or number three, experimenter is actually identified as a professor, or experimenter is identified as a student. So these three different kinds of manipulation of the same independent variable is possible. There are many different kinds of manipulations of independent variable, as some of the example has been discussed in the past slide. Some example of manipulation include instructional manipulation. You just give different instructions. Sometimes it's a behavioral manipulation that, for example, participants needs to perform different kinds of tasks. And then the other interesting kinds of manipulation is a staged manipulation. Staged manipulation typically occurs in social psychology experiment. Its aim is to create a specific social situations which is the target of interest by the researcher. Okay, and typically in the staged manipulation, the key attribute is presence of one or more confederate or actors who are actually implanted in the experiment to create specific social situations. For example, in Milgram study, that was actually the setup was to create the learning experiment, but the true intent is to create the obedience situation where participants needs to actually obey to the authority. Similarly, in ASH experiments, the situation is created to increase the peer pressure. When you manipulate independent variable, one of the things that you need to be careful about is the strength of manipulation. You would like to have a manipulation strong enough to produce an effect. But if the manipulation is too strong, the experiment becomes sort of surrealistic and doesn't have any corresponding reality to the real world because it's too strong a manipulation. Okay, so you gotta get to the sweet spot. Okay, so that's a skill based on experience. Also, other issue that you need to think about is, especially this is true for when you are conducting social psychology experiment with staged manipulation. You creating the social situation by doing some sort of staged manipulation, that doesn't mean that participants actually perceive the desired social situation that you created. Therefore, in order to ensure that the manipulation was actually experienced, you need to have a manipulation check. So the purpose of the manipulation check is to examine whether or not manipulation was experienced or perceived by a participant. This is separate from whether or not manipulation actually produced an effect on dependent variable. These are two separate issues. I'm going to repeat it one more time. So the manipulation check measures whether or not manipulation was experienced by a participant. So this is a methodological issue. This means the manipulation check concerns about whether or not method is working. Okay, and then there is a separate issue of whether or not the manipulation, when successful, does it produce actual effect on the dependent variable. That is your issue about the hypothesis. These two issues are separate. Little more additional points about a manipulation check. So the goal of the manipulation check is to examine whether the manipulation is experienced in the intended way. So when are you going to administer the manipulation check? Okay, so obviously because the manipulation check should happen after the manipulation, it needs to happen after the manipulation of independent variable. So there are two choices, whether that should happen before the administration of dependent variable or should be after the administration of dependent variable. I would like you to think logically which is the most important. So remember that the issue that you need to consider in here is the most important things in experimentation is to maximize internal validity. So this means there is nothing in between manipulation of independent variable and a dependent variable. And if you have a manipulation check after the independent variable and dependent variable, manipulation check may influence the measurement of dependent variable. That's not preferred. That should be avoided. Therefore, the manipulation check should be given after the dependent variables, even though the quality of manipulation check may be slightly compromised. Okay? Because it's okay, the manipulation check, the quality of manipulation check may be a little bit compromised. The most important is to preserve the quality of dependent variable. And by manipulation check, giving manipulation check after the dependent variable, you can actually maximize the quality of dependent variable. Okay, and then this slide contains the list of how the manipulation check, the results of manipulation check, affects your interpretation, and please read these things carefully. Now we are moving on to talk about how you think about dependent variable. So important factors in determining the dependent variable include sensitivity of the dependent variable. So we will talk about that in the next slide. And then also you need to think about the meaningfulness, whether or not the use of this variable contribute to answering your research question is the things that you need to consider. We already talked about validity and reliability, both of them are important. Also, in some experiment, you may consider having multiple dependent variables. If you have multiple dependent variables, you need to consider the order in which these dependent variables are administered. And then finally, practicality. That means cost of administrating the dependent variables, such as fMRI is obviously expensive. So these are the kind of consideration that you need to have. The sensitivity means if you assume that independent variable is hypothesized to produce an effect on dependent variable, independent variable and dependent variable must be related. So that's a covariation. As the independent variable change, dependent variable must change. However, there are some reasons to believe that in some cases that's not going to happen. For example, two different kinds of effects that may compromise the sensitivity, which is floor effect and seeding effect. So the seeding effect is like this. Let's say I'm giving difficult questions and an easy question, which is in my mind. However, both questions may be too easy for students. In that case, even though I intend one question to be easier than the other question, both of them get the 100% correct performance. In that case, it's called seeding. It's not sensitive, because the reason is it doesn't produce the effect it's supposed to be sensitive about. The opposite is a floor effect. I give 2 or 3 questions whose difficulty level I intend to manipulate, one to be more difficult than the other, but in both cases it's too difficult, nobody get the right answer. That's actually floor effect. That's also insensitive because the reason is nobody can answer the question. So floor and seeding effect definitely compromise the effectiveness of your method. So that you need to be careful about. So type of dependent variables. I can think of 3 different kinds of dependent variables here. Number 1 is self-report. That's an answer to survey questions in which experimenter trusts the content of the answer given to the survey. That's a self-report. That's not trustworthy, right? And then there is a behavioral measures, which is more trustworthy. This includes like a recall. That means how many of the words from the list can be recalled, or how well, what's the performance in the specific problem solving task. Or, for example, like in Milgram study, the people's willingness to administer the high-intensity electric shock. And then finally, there's a physiological measure, which include the action time, galvanic skin response, fMRI, eye tracking. Some of the behavioral measure and the self-reports are confusing. Let's think about the memory. Let's say I ask you about your childhood memory. That's a self-report, right? However, asking how much one remembers from a text material one read is considered behavioral measures. Both of them are memory. So how are they different? The difference is that in A, which is asking about your childhood memory, I'm trusting what you report, and I'm not verifying that. That's why it's a self-report. And you don't, there is no way that I can verify whether or not you're giving me the truthful information. There is a social desirability bias. There may be bias due to context and so on and so on. Okay? On the other hand, in asking how much one remembers from a text material, I can always refer back and compare your performance level of how much of that information was recalled, how much of a distortion that I observed. Those are the performance. So the self-report measure is focused on the content, and the content is trusted. In the behavioral measure, the best way for you to think about behavioral measure is it's translated as a performance, where you have some objective reference baseline as a reference point. In choosing or selecting dependent variable, obviously practicality should be given a consideration. Time, money, and meaningfulness, these things are important. And then finally, the order. So the base is the most important things needs to be given first. And one specific confusion is like when administering both open-ended and multiple choice question, which one should come first? Okay, so in that case, the open-ended question should come first, because once you give the multiple choice questions, multiple choice question is going to affect the open-ended measure, but open-ended measure is less likely to affect the multiple choice measure. So therefore, open-ended measure should be given first.
So when we talk about, this is almost about getting back again to independent variable. So here we talk about this in relation to this notion of control. Okay. So the experiment means you are going to manipulate one factor at the time while controlling all the other things. So the question is, what do we mean by so experiment involves typically at the minimum you have to have a treatment condition, which involves manipulation, and then the control condition. So the independent variable is the difference between treatment condition and control condition. But what do we mean by control? So we need to really think about what is an appropriate control condition. For example, is it an absence of manipulation, or do you need to create artificial control condition? This is very important because, like for example, let's think about placebo effect. Right? Do you know what's placebo effect?
Yeah, that's like you basically have two groups. You give one group an inert or sugar pill, and you give the other one the actual medication, for example, in medical research.
So the placebo condition is a placebo control, but which is not exactly the same as control condition.
Right.
Why is it so? There is a so say that this is a clinical trial of particular kinds of medicine, right?
Right.
So you have three conditions where somebody is going to get the real medicine, that is treatment condition.
Right.
And then a control condition means they get nothing.
Right.
But why those two conditions are not sufficient?
Because the you want to know whether or not the treatment or the
Expectation.
or the expectation of the treatment.
That's
is
right.
what's causing
So
it.
essentially what it's saying is, so when you compare the control condition, which is the absence of the treatment, versus experimental condition where they get the physical treatment of the actual specific medication, then it's actually there is a psychological effect of taking the medication is confounded with the taking physical act of taking the medication.
Right.
So therefore, you have to create to tease apart the expectation, the placebo condition where you're going to only generate the expectation without the actual effect.
Right.
That is the placebo control. That's right. So this theory tells in some circumstances you need artificial control condition. Okay. So this is very important as you actually look at the next slide, which explains that logic of placebo condition in more detail. I want you to note this. This importance of the placebo condition is not just in, for example, clinical trial or physical or chemical medicine. It's also relevant to, for example, psychotherapy.
Right.
Okay, because the reason is, okay, so somebody, maybe clinical psychologist may kill me by me saying this, but it's possible. Actually, the effect of the therapy may be due to placebo effect, that they're getting therapy.
Mm-hmm.
So, say that, say you come up with a particular kinds of therapeutic technique. You have to think about placebo control of therapy.
Right.
So what do you think? Do you think are there such things as a placebo condition for testing the effect of therapy? What would be the kind of the potential placebo condition?
There definitely is, because just the simple fact that, like, if say you're doing it in a laboratory setting, there's just the simple fact that you're going to a new location that could alter the behavior that you're supposed to be like.
So specifically, well, say there is you propose that there's this particular kinds of therapy technique that you imagine, right? You can come up with.
Right.
What's the kind of placebo condition that you're going to set up?
Let's
be complete.
Yeah.
Are there anything that you can think of on top of your head?
It's difficult.
So I tell you that. So let's say I have this wonderful therapy technique.
Mm-hmm.
Okay. So that means, I'm supposed to be trained to practice that particular kinds of therapy technique.
Right.
Right. So it's the training that makes difference to me.
Mm-hmm.
So therefore, the one potential placebo condition of measuring the effect of this therapeutic technique is you're gonna give the idea this is gonna be new therapy, but maybe the placebo condition, it's actually not the trained individual, but something like graduate students can give that, or any random people can give that.
Right.
You know what I mean? And if you still produce the effect that's similar to the actual therapist, that means it's all effect is placebo effect. It's just the expectation.
Okay,
You know what I
I
mean?
could see that, but like that goes back to the issue of like saliency, like
What do you mean saliency?
the the security clearance versus the lab coat versus the title issue.
Could you elaborate on that a little bit?
So like does having like a professional who's trained versus a grad student who is not as well trained do the therapy, is that really a significant difference to the participant, just as like going through like going through and getting a security clearance versus somebody in a lab coat versus somebody in plain clothes, or somebody who's addressed as professor or someone who is not.
Yeah, but in this case, I think it's slightly different. So say that what you want to test is this particular therapy technique.
Right.
So that means this individual needs to be trained with that technique and has very extensive understanding of how this works.
Right.
So that's me, for example. Say that let's assume that I'm a therapist. But I can have somebody who just read about it, 5 hours, how it works. Then there got to be some difference. You know
Okay.
what I mean?
Yeah.
So therefore, because the way in which the conversation unfolds and the kind of tiny bit of intricate control of the conversation or interaction that happens in a therapy session, because otherwise, if you get the effect with this other individual who, quote unquote, execute or practice that therapy just by reading 10 minutes of reading, that means anybody can do that. So it's not a specific technique.
Okay, I see that.
You know what I mean? Okay.
In manipulating independent variables, at least you need two conditions, one of which is actually treatment or experimental condition, the other one is a control condition. And based on my own experience of setting up an experiment, the most important and the difficult decision is what kind of control condition is an appropriate control condition. Is that a control condition is the absence of manipulation, or is it created by artificial control? So that issue is best understood with reference to something like a placebo effect. Okay, so when you try to measure the effect of a particular medicine, absence of medicine is the common sense based control condition. However, administration of the medicine has two components of effect. One is the actual effect of chemical onto your physiological system. But there is an also psychological effect. So therefore, these are two effects. And then what you are interested in research is often the pure effect of medicine as a chemical, removing the expectation. So in that case, you need to set up the artificial control in which you are going to give only the expectation of medicine without the actual chemical effect. That's the placebo condition. The same thing can be said about, let's say, you are doing experiment on the clinical trial on whether or not a particular therapeutic technique work, right? So is it basically the absence of therapy that serves as a control condition, or you have to set up some sort of fake therapy condition? So those are the important considerations that you have to give. So as you can see, finding appropriate control condition is the most important and a very difficult decision that you need to make when you set up an experiment. Finally, experimenter has a hypothesis and then expectation of what the outcome of an experiment should be. And that may actually influence the outcome of experiment even though you don't want. So it's an unintended influence. So in order to reduce the unintended influence, solution is often you will create double-blind study where experimenter is not aware that which person is actually assigned to control and which participants is assigned to experimental condition.